Body Beautiful. With us today, we have plastic surgeon Dr. Joseph Mele. We're talking about liquid facelifts. Later, we'll be taking your calls, answering any questions you might have for the doctor. Here's the phone number, 415-561-8753. We'll also be posting the number for the doctor's office, so be ready to jot that down. And certainly before you ever have any kind of procedure, always a good idea to have a second opinion.
Yeah. I think that is a good idea.
It's, especially when you're stepping it up and you're taking that surgical approach.
Well, for surgical, you definitely want someone who's board certified in their specialty. So if you're having plastic surgery, it's good to have a board certified plastic surgeon.
Now, in this area as well, you have a lot of dermatologists and even some dentists doing these kinds of injections. I guess, and I'll leave it up to you to address this, but I mean, there really is artistry involved in this, isn't there? I mean, it's just not just injecting and, I mean, if you put it in the wrong place, there are all kinds of contraindications, things that could happen.
Sure, you don't want to accent the wrong areas, because that will make things look worse rather than better. So there is some artistry, and it's also just a knowledge of the normal anatomy, what normal aging does, what ratios are appropriate for different parts of the face, and being able to restore those ratios is a lot of what I'm doing. But beyond the science, beyond the math, there is some art involved, because it always looks better a little bit one side or the other of the formula. In order to get it right. I think I have an advantage as a plastic surgeon because I do plastic surgery. I look at the face, the skin from both sides. I know what's under there. I know where things are. So when it comes to trying to stop muscle motion with the neuromodulators, I know where those muscles are. I've seen them from inside and out. And it gives me a better sort of three-dimensional view of what's going on in order to get the results that I want. There
was a product years ago, it's no longer being used, it's not on the market, but it was a collagen-based product as a filler.
Sure, that was the first filler.
It was the first filler.
The 1970s is developed right here in Stanford, yeah.
But it was based on bovine, which is cow.
Bovine. Yes, it was bovine collagen. We didn't have the ability to genetically make human collagen.
And the downside of that was people had allergic reactions, right?
Yeah, there was a small difference in a couple of the molecules where it's put together, and 1 or 2% of people would have an allergic reaction. As a result, we'd have to skin test people. So we'd do a little test, sort of like a TB test, just a little test in the arm, and make sure they didn't get redness or irritation, because a little spot on the arm that's irritating is one thing. A big dose in the lips that's red and irritating and itching for months is a bad thing, and that's what we wanted to avoid. With these, there's no allergy. There have been some reports of folks getting sort of an acne-like breakout over it. That was early. The first one to market here in the U.S. was Restylane, and when it first came out, I saw a few cases where there's a little bit of redness. They went back and looked at their product. There was a protein in there. They were able to reduce the amount of that protein, and since then I have not seen the problem. So it's very well tolerated.
Now, there has been some discussion about the Restylane being a hyaluronic acid. Wait, it sounds like we're in chemistry class here.
Sure.
But because it is part of the body, that it actually encourages the body to go ahead and produce some of its own collagen.
Yes.
I don't know, elastin,
Most
all
definitely.
the important building blocks here.
Yeah, we find the hyaluronic in the we find hyaluronic in the basement layer, the bottom part of the skin, and it's also in all of our joints. It's a good lubricant, so we find it in all of our joints. And in those areas, there's normal wear and tear, and it's one of those signals to the body that it needs to repair. So when we put hyaluronic acid in, we put it into those areas where there's the fold, there's kind of a two-phase response. There's that initial bumping up because we're adding volume there, and it sucks a little bit of water in. And then as that starts to break down, the body makes collagen in its wake, which helps to maintain that result. So instead of just having a peak of the product goes in and the product slowly goes away, we get a nice plateau phase where we get excellent correction that's maintained until it slowly starts to go away at the end.
Okay, well, so for those people who are fearful about injecting things like botulism toxin,
it sounds scary.
Botox,
yeah, the first guy who did that was very brave.
Very brave.
Or not. Well, not very smart, but I think they were very brave.
But again, the genesis
because it
of
works so well.
Yeah.
And the difference between that and the poison where people are sick is that the doses we're using are like 20 units to keep the frown lines from happening.
Right.
Lethal doses are in the thousands.
Okay.
So very, very safe.
I don't know if we have time to go to the phone lines here, but it looks like we've got Kevin from Oakland. Kevin, do you have a question for the doctor?
Yes, my name is Kevin, and I was calling because I have a scar under my eye from I had stitches, and I was wondering what can be done to like even out the scar tissue under that scar that's under my eye.
Sure.
Thanks, Kevin.
Do you have a scar underneath the eye? It depends on the type of scar. If it's a flat scar and it's just that it's discolored, then surgery is probably going to be better. If it's a good color but it's depressed, then the fillers may help in that area. Or if the animation, the normal squinting is making that scar more prominent, sometimes the neuromodulators like the Botox will work. If the scar is raised up, then probably surgery again is better. Scar remodeling and scar revision, there are many different ways to do it because there are many different types of scars. So it would depend on the type of scar you have, the location, in terms of what's going to be the best treatment.
I mean, is there any really effective way of dealing with scars? I mean, I know there are products out on the drugstore shelves, but short of...
It depends on the type of scar and the age of the scar. So newer scars are a little easier to modulate and get better. Simple things like massage work very well.
Okay.
So the Medermas, the topical silicones, those work very well because it's a way to get someone to actually massage it. The silicones at least have been shown to be clinically active and helpful.
We need to take a very quick break. This is all good stuff. We have some phone calls to take care of, but we'll be back.